Dr. Zorba Paster is with us once again, taking your medical questions. Hello, Zorba.
Good to be here.
All right, so that phone number to call, 608-270-9933. While we wait for calls to clear, the national COVID health emergency in the U.S. officially comes to an end tonight at midnight. So over 3 years since the first COVID case, what have we learned?
Oh, that's a really good question. Well, first of all, from the point of view of making immunizations, we've learned a lot. I mean, it's amazing that we actually got injections
in that amount of time.
Totally amazing. But when it comes to rolling it out to the public, we have a lot to learn. We really didn't do it right. But if you look, for instance, at polio vaccines, when those first rolled out, it really didn't catch on with the public until Elvis Presley took his Salk vaccine on Ed Sullivan's show, and all of a sudden there was a boom in the number of people who took the vaccine. So this is not, and you're a little shocked that it was Elvis. They wouldn't shoot him below the hips, but they would shoot him with the arms. That was the whole issue. But they did. But it was Elvis Presley who did it. And so we've got a lot to learn. But the reality is, COVID is here forever. It's not a pandemic now. It's endemic, and endemic means it's just around all the time. And you know, we had a lot of endemic diseases years ago. We had measles, mumps, German measles, chickenpox, we had meningitis, we had a whole bunch of different things that were endemic. We took care of them with vaccines, and I look forward to the fact that every fall we're gonna have a flu shot and a COVID shot, and over time I think the politics behind it and the acrimony between family members is gonna dissipate, because frankly, this happens all the time when new technology comes in.
Absolutely. All right, we have a lot of calls. Let's start with Kay in Madison. Hi, Kay, what's your question?
Hi, I have been having a problem with my leg and lower back, and I'm going to the doctor, and they assigned me to go to PT, and now I'm doing traction. Now, I haven't had great results with that so far. I've done only 2 things of traction.
Sure.
What is the difference between going to PT for something like this or to a chiropractor?
Well, first of all, that's a very good question. Chiropractors do things that are different. They manipulate you differently. Some people do well with physical therapy. Some people do well with chiropractic, and that's the reality. There's a number of people, especially with acute back pain, where chiropractic works better than physical therapy, and there's studies that show that. And a lot of that has to do with the connection of the chiropractor, the practitioner, with the patient. There's an art to medicine, and then there's the technology. So my recommendation, if one doesn't work, try the other.
And insurance pretty much covers chiropractic.
Absolutely. The insurance by state law has to cover a certain number of chiropractic visits.
All right, we have Gail from Madison. Hi, Gail. What is your question?
Oh, hi. Thank you for taking my call.
Welcome.
I was in the hospital mid-April and had some gastrointestinal surgery, and I contracted C. diff while I was in the hospital, which is nasty, okay?
Right.
I'm finally recovering. I'm seeing the light at the end of the tunnel, but I want to know, my sister-in-law had it. She had a relapse 2 weeks after she got over it. What's the best way to avoid a relapse? I know you have to build up the good flora in your intestines, and I don't recommend this for anybody.
Oh, no. Nobody wants C. diff. So C. diff is a common thing. Well, it's not rare, but it's a common thing you get after antibiotics. So when you get antibiotics, you can get an overgrowth of Clostridium difficile that basically is in your gut, and we have treatments for it, but it can take a long time to get better. The best way to keep from getting C. diff again is not to get antibiotics. So my recommendation, among other things, if you've ever had C. diff, do not ever get antibiotics unless you absolutely need them, because you might get C. diff again.
Wow.
I've never heard of it.
It's a bacterial infection.
Oh, it's
very
nasty.
common post, and it's nasty. It takes a long time to get better.
All right, let's go to Diane in Mazomanie. Hi, Diane. What's your question? Diane, you there?
Yes.
Go ahead. What's your question?
Okay. Hi, Dr. Zorba.
Hi.
I'm 75 years old, and as a child, our family never had chickenpox. Do I still have to get the shingle shot?
Well, you should get the shingle shot, because you may have actually had chickenpox, but don't know that you had chickenpox. So there's some people who had chickenpox and they would only have 1 or 2 sores, but they actually had chickenpox. If you want to know for sure, you can get a blood test to see whether or not you had it, but my recommendation is get the shingle shot, because if you did not have chickenpox and you get, well, you're not going to get shingles, but you get chickenpox as an adult, it's awful. But once again, got to talk to your doctor, because they may recommend the varicella vaccine, which is the chickenpox vaccine instead.
Is chickenpox still going around now?
Very little chickenpox, except for people who are not immunized in certain parts of the country. We're good. In Wisconsin, we're really good at getting immunized. If you look at our viewing area, 85% of the adults were immunized for COVID. I mean, come on.
Yeah, it's
we're
pretty,
smart people.
It's pretty amazing.
We make intelligent decisions. You know, we don't rely. We don't rely on the wrong sources. We rely on the right sources. That's why we're here. You know.
That's why we're here.
Well said. All
All right,
right.
Zorba, thank you.